Hi and welcome back to the Men's Health Hub, where we're going to discuss the topics that matter most to your health and to your well-being. So today we're diving into a condition called paraphimosis, a condition that occurs whenever the foreskin becomes trapped behind the head of the penis and it's not able to return back to its normal position. Now that can cause significant discomfort, as you can imagine. It can cause swelling and even a medical emergency if it's left untreated. We want to explore the causes, the treatments and the prevention strategies for paraphimosis, including an in-depth conversation about circumcision, its pros, its cons and its impact on sexual health. Well, without further ado, let's get started. So what is paraphimosis? So really this is a condition that affects uncircumcised men. It happens whenever the foreskin's pulled back behind the glans of the penis, so that's the head of the penis, and it becomes stuck, leading to swelling, restricted blood flow, and it can develop during medical procedures. It can develop during sexual activity or as a result of improper hygiene. Now it's treatable, so severe cases sometimes will require medical attention, but generally speaking it can be managed at home. So whenever it comes to the causes, medical procedures are one of them, but sexual activity or trauma, so rough handling, injury during intercourse, they can all contribute to this condition. Infections such as inadequate cleaning of the foreskin can lead to inflammation and to swelling. And then tight foreskin, so this is called phimosis, whenever men are born with tight foreskin and they're at higher risk where this retraction is going to become more difficult. So the impact on you as a man is that you'll end up with swelling and pain in the glands of the penis and around the foreskin. There can be discoloration of the penis. It can often appear as dark red or bluish, and there can be difficulty urinating in severe cases. Now, from a sexual health perspective, it can significantly affect intimacy and intercourse. So the discomfort can reduce sexual desire, whilst the condition itself can cause anxiety around sexual activity. And men may avoid intimacy altogether, fearing a recurrence of the injury. Now, the treatments, generally speaking, there will be focus on the immediate issue in preventing recurrence. So a healthcare provider might apply lubrication, might apply ice or gentle pressure to reduce the swelling and the position of the foreskin. Medications, anti-inflammatory drugs and pain relief can sometimes help with the symptoms and facilitate recovery. And then there is surgical interventions. So this is the dorsal slit procedure, which involves a minor incision to relieve pressure and allow the foreskin to return to its position. Now, circumcision is often recommended for recurrent cases of this. Whenever the foreskin's tightness will make future episodes more likely. Now, circumcision is the surgical removal of the foreskin, and whilst it's a definitive solution for paraphimosis, it's a personal decision that comes with benefits and drawbacks. So let's break that one down. The pros are you can prevent recurrence. It eliminates the risk of paraphimosis or phimosis entirely. It will help improve your hygiene, so it reduces the need for careful cleaning underneath the foreskin, lowering the risk of infections. It reduces the risk of STIs. So studies published in The Lancet show that circumcision reduces the risk of certain sexually transmitted infections, including HIV. And it reduces the risk of penile cancer. So although this is rare, circumcision has been associated with a lower risk of penile cancer. The cons. So the difficulty for men is there's a fear around the loss of sensitivity. Research in the BJU International highlights that this is a concern for some men. The foreskin contains thousands of nerve endings. Its removal can reduce penile sensitivity. However, if you suffer from premature ejaculation, that might come as a godsend. Surgical risks. So like any surgery, circumcision carries risks of bleeding, infection and of scarring. And circumcision is irreversible, so it's a permanent condition and it may not align with everybody's personal or cultural preferences. Now, some studies suggest reduced sensitivity post-circumcision. Others, like the Journal of Sexual Medicine, report no significant difference in sexual satisfaction or performance. So ultimately, the impact varies on the individual. Now, preventing Paraphimosis includes maintaining proper hygiene, so you gotta make sure you're clean down there. So clean underneath the foreskin regularly and return it to its natural position after cleaning or after medical procedures. Be mindful during intercourse. So communicate with your partner to avoid sudden or rough movements that could injure the foreskin. And address it early. So if your foreskin is tight, consult a healthcare practitioner about treatments to prevent complications. And protect against infections. So use condoms during sexual activity or avoid irritants such as harsh soaps. Now, paraphimosis is manageable. It's a condition with the right care and preventative measures. If you understand the role of hygiene, communication and medical options, then you will be able to make the right decision for you. You can visit the Men's Health Hub for more insights and more resources. But thank you for joining us on this journey, and take care of your sexual health.